Thank you so much for joining this evening to talk about health equity, past, present, and future. We're going to be spending a little bit of time talking about what is health equity, then talk about what we did this year in the General Assembly with our Maternal Health Coalition, talk a bit about COVID-19 and adult vaccinations and the difficulty of reaching various communities with information about vaccines and about health equity, and then talk about looking forward at the policies we're going to be taking on, especially with regards to expanding healthcare coverage to folks who may not have it at the moment. So again, my name is Sheila Herlihy. I'm the faith organizer at Virginia Interfaith, and I want to share the mic with Kristin, Lennox, and Freddy Mejia. So Kristin, would you go ahead and introduce yourself?
Sure. Thanks, Sheila. Hi, everyone. Good evening. My name is Kristin Lennox. I use she, her, and we pronouns, and I'm the Advocacy and Engagement Manager over at Voices for Virginia's Children. I am here in Emily Moore's stead, who is our policy analyst. And so come bringing lots of news and updates from her. And I will pass the mic over to you, Freddy.
Yeah, how's it going, everyone? Thank you again, Sheila, for the invitation. My name is Freddy Mejia. I am the Deputy Director of Policy at the Commonwealth Institute, and I lead our healthcare as well as our immigration campaign. So I'm just excited to meet with you and tell you a little bit more about some of the work that we have been doing in partnership with so many in Virginia. So.
Thank you so much, and thank both of you for all the work that you do and that your organizations do as well. First, I'd like to give just a little bit of background. Equity has become a strangely loaded term in the political discourse, as it were, but truly, health equity, I'm looking at the CDC website right now. Health equity is the state in which everyone has a fair and just opportunity to attain their highest level of health, which involves addressing historical injustices and contemporary injustices, overcoming obstacles to health and healthcare, whether they be economic, social, or whatever they look like, and then eliminate preventable health disparities. These are a lot of big words, but basically what it means is acknowledging that sometimes we have not treated people equally in healthcare as in every other field, and addressing that, and then overcoming the disparities and the barriers that get in the way of people getting the healthcare that they need and deserve. Many of our faith traditions talk about healthcare as a human right and as something that every person is entitled to. There are a lot of miracles in the Christian tradition, but in other traditions as well, where God, in whatever form, provides healing, doesn't usually ask for payment, doesn't usually ask for credentials or worthiness, simply offers the healing as that first step toward achieving a better life and a more just society. And so at the Interfaith Center, we are dedicated to that. And that's why we've been in these coalitions for so long and been working on these issues for a while. Our big entry into the health equity field was in the late 2010s when we were part of the coalition working on Medicaid expansion. And we successfully got Virginia to offer Medicaid to an additional 500,000 individuals who would not have otherwise qualified. It increased federal funding for Medicaid and was a huge benefit. And now we're having an opportunity to further expand access to healthcare and to talk in various faith communities in these trusted environments about what healthcare can look like and how to find helpful resources. So, in the 2021 General Assembly, they expanded healthcare in part because of Virginia Interfaith's work. They expanded healthcare to women who were pregnant and going to have a child. The undocumented women could get perinatal health care who would have qualified for Medicaid, under Medicaid. And this just makes good sense. It ensures that people in our society are cared for. And that brings us to the last couple of years as we've been working to expand our access on maternal health care. So Kristin, can you talk a little bit about, I kind of divided this into past, present, and future. All of it is past and present and future, but Kristin's going to share a little bit about what the Push Maternal Health Coalition and Voices for Virginia Children has been doing on this particular issue.
Yeah, I've got a bunch of updates from Emily. Again, that's Emily Moore, and I can put her contact information for folks that have more questions for her as our policy analyst. But these are updates from this General Assembly session that just ended, pertaining around the progress around maternal health. So these updates are a result of the work of Dora Mohammed, who put in lots of work, I think, in just establishing these spaces and adding a lot of contributions. And it was important to Emily that the culmination of the years of work she put in was recognized. Convening these 5 regional roundtables with community members and stakeholders in the summer and fall 2022. One of the glaring gaps in policy is robust infrastructure and supports for community-based healthcare, such as community health workers, doulas, and midwives. So the following 3 policy changes that I'm going to go over were prioritized for this 2023 legislative session. So where a lot of the focus was. So the midwifery medication bills. Those are House Bills 1511, and then the Senate cognate is Senate Bill 1275. Those were carried by Delegate Adams and Senator Donovan. Both of those passed both chambers with unanimous bipartisan support. What does this mean? This bill authorizes licensed midwives who work in freestanding birthing centers to obtain, possess, and administer drugs and devices within the scope of their practice. So these medications are typically used during labor to ensure safe deliveries. The bill requires the Board of Medicine to develop and publish best practice and standards of care guidance for all such drugs. So this bill also requires any licensed midwife who obtains, possesses, and administers drugs and devices to complete all Alliance for Innovation on Maternal Health patient safety bundles that are offered by the Virginia Neonatal Perinatal Collaborative. Thank you, Sheila. She's dropped some resources on the midwifery bills through LIS, which is a resource where you can find all of this jargon on there too. So those are the midwifery medication bills. And then there's the perinatal health hub bill. That was championed by Delegate Rasul through House Bill 1567. That passed both chambers with unanimous bipartisan support as well. This directs the Department of Health in collaboration with the Virginia Neonatal Perinatal Collaborative, the Virginia Maternal Quality Care Alliance, and Urban Baby Beginnings to convene a work group of stakeholders to evaluate strategies that'll further reduce maternal and infant mortality rates and make recommendations to expand the perinatal health hub model across Virginia. And then finally are the implicit bias bills. These speak a lot more to a lot of the equity pieces that you were also talking about too, Sheila. These were House Bill 1734, that was championed by Delegate Head. And in the Senate, that was from Senate Locke, Senate Bill 1440. But both of those actually failed to pass this session. 1734 did not pass out of House Health, Welfare, and Institutions Subcommittee. The bill was amended at the request of a lobbyist group, and the amendment changed the language so that it no longer required practitioners to take implicit bias continuing education, and only made it a requirement for the Board of Medicine to provide information on the continuing ed trainings. I think someone might not be on mute. There you go. And only made it a requirement for the Board of Medicine to provide information on those trainings that would have been available, which would include some form of implicit bias training. The Push Coalition could no longer support the bill with those amendments. So the bill patron asked to not have the bill heard in its last subcommittee hearing. So that means it's left it in committee, and that effectively killed it. And then Senate Bill 1440 was similarly amended in the Senate Education and Health Professions Subcommittee. And as a result, in the full Education and Health Committee meeting, Senator Locke asked that the bill be passed by indefinitely. So it was defeated, and to send a letter to the task force on maternal health data and quality measures to complete a study on the need for implicit bias training for healthcare professionals. So the bill in its original form would have required the Board of Medicine to adopt and implement policies that require each practitioner licensed by the board who has direct contact with people who may or may not become pregnant to complete 2 hours of continuing education related to implicit bias and cultural competency in healthcare at least once every other license renewal cycle. So those are the major updates from maternal health with regards to this 2023 GA session. And Jean asked a question about what the prenatal group study is intended to achieve. I don't have an answer to that, but I can definitely connect you with Emily Moore or Sheila.
I can speak to that at least a little bit. The study, so the perinatal health hubs are this model of addressing around 40% of counties in Virginia are called maternal health deserts, which means they don't have midwives or OBGYNs accessible for people who are giving birth. And that's a problem because, takes an hour to get to the hospital or wherever you might be going to give birth. Perinatal health hubs are an interesting way of dealing with this problem where they don't necessarily build a new hospital everywhere, but they bring resources together within a community. And there's a few, I think there's 4 around Virginia. Don't quote me on that. There is a number somewhere on our fact sheet, but it's not in front of me right now. But there are some perinatal health hubs in Virginia, one relatively close to Roanoke, where Delegate Rasool lives. And they just do incredible work, sort of doing that pushing out into the community to make sure that people who are at a physical distance from the resources are still hearing about the resources and have access to services. Creating these perinatal health hubs would give that greater accessibility to people who live in maternal health deserts. This bill, originally we were hoping to create more perinatal health hubs, but the current breakdown of the General Assembly means it is hard to get bills passed. Everyone digs their heels in and feels real partisan, especially in an election year. So instead, they settled for a study about, so that the GA can learn, the General Assembly can learn more about these perinatal health hubs and decide whether and how to implement them on a broader scale around the Commonwealth. Does that make sense? Great.
Yeah, that's beautifully put, Sheila. I feel like studies are usually just some sort of compromising ground to learn more, to find more, and to also, give those that are the patrons some solid data to also progress that bill forward next session too.
They do love their studies. Kicking the can down the road. Well, yeah. And I mean, to be fair, they passed, this year's session was 46 days and they passed 1,400 pieces of legislation, which is a lot. And I don't know, in 46 days, I couldn't keep up on that many bills. So sometimes, especially when it's a relatively new concept, they really are honestly kicking the can down the road, but it's partly so they can have more time to understand. It's a win. It's a small win, but it's a step in the right direction. Yeah. Great. Any other questions? Awesome. Well, then I will go ahead and share a little bit about where we are now, kind of the present of adult vaccinations. As some of you might be aware, we've been partnering with the CDC and the Vaccine Equity Administration Program and Community Catalyst to increase awareness about the COVID-19 vaccines, and then more recently about health services and adult vaccinations in general around Virginia. So we are in year 3 of COVID. It's not over. I still have a newsletter that tells me where the community spread level is every single week. We're at low right now. I'm really glad, but that's new as of this week because it was medium last week. Oh, Jenny, I'm going to go ahead and mute you. And, you know, in the midst of all of this, it is important that we keep awareness up. Toward the beginning, because you all know this, COVID was a novel disease and there was not a lot of clarity about the direction we should go. And it was hard sometimes to know which sources could be trusted and not trusted. Then we had more clarity about masks and about vaccines, and that helped. But at the same time, folks who had been anti-vaccines from the beginning or skeptical sometimes would dig their heels in and felt like there wasn't a clear path forward. So we want to address people without judgment, but also still give people in our communities the opportunity to get these resources, to get this protection. And so we've been working particularly with faith communities to do that. We've been working with communities, especially communities of color, faith communities that serve the immigrant population, to talk about what is the history of inequity? Why might there be a distrust of the healthcare system? You know, I work with Spanish-speaking congregations sometimes, and folks just are reticent to go to somewhere that they're going to have to write their name and maybe their social security number or their passport number down because people are afraid of getting caught up in any government system. And so there is legitimate fear there, but there's also legitimate ground to be gained. So coming and reaching people within their faith community is often a lower barrier and a higher trust environment to talk to folks about these potentially scary issues. Through this campaign, we've been recording some public service announcements from various clergy, and I see Reverend Dr. Flood is on the call, so I won't put you on the spot. I won't show your PSA unless you want me to, but I might put the link in the chat. But I will share one of these PSAs because I just think that it is really interesting. This one is a good one. Because it is really important. And so we've been sharing these with faith communities, and we'd ask that you help us to continue doing that. Also, there's talk, you know, the declaration of emergency will be ending in May. And that means that there is still a federal stockpile of vaccines, so folks won't immediately be cut off from vaccines. But people who can get vaccinated and haven't yet should take advantage of it now while it's free. And so we're trying to get the word out about that over the next several months, and also just about the services that local health departments can provide. If you have questions, feel free to chat with me about it. I'm going to go ahead and share my screen so you all can see this pretty PSA we put together.
My name is R. Perez Gatling, and I have the honor of pastoring Ebenezer Baptist Church in Virginia Beach, Virginia. Black and brown people died at alarmingly higher rates from the COVID-19 virus. The pandemic raised global awareness of the inequities in healthcare access and delivery within communities of color. All persons have equal worth, and every person should have fair access to healthcare treatment, resources, and information. Justice in healthcare practice and delivery demands a commitment to affirm and serve the humanity of every person. Our God is a God of justice, which means every person is treated equitably. We must heal the harm of the past in order to build more trustworthy healthcare systems for the future.
This message was brought to you by
So, in case you were wondering, you can follow us on social media. And somehow it's still playing. And here we go. Yes, I see in the chat, I can share the link to the PSAs. I will give the link to the entire PSA playlist, which is, well, it's a little much, but then you'll have the whole playlist and you can see all of the PSAs. And there's going to be a few more being published over the next month or two. I don't have a ton more to say about that. There is more to be said, and I will hopefully be following up with some of you about that because this is not over and we want to make sure that people are aware of the resources in the community. But for now, feel free to share the PSAs, feel free to share the resources on our website about it. Awesome. Freddy, I turn it to you.
Great, thanks, Sheila. Well, I figured I'd get some slides so you wouldn't have to look at my face for like the 15 minutes, 10 minutes that I've allotted. But once again, I'm Freddy Mejia from the Commonwealth Institute. We are a nonpartisan, nonprofit organization that does research and advocacy on issues that impact low-income Virginians as well as communities of color. So today I'm going to talk to you about a policy called Cover All Kids that we have been working on for about two and a half years, and that Virginia Interfaith Center has really been helpful with. So I just want to shout them out from the get-go, but here we go. So why is this policy important to equity? This policy is born out of looking at data. And so on the face value, right, children uninsured rates have gone down in Virginia, which is a great thing. So as you can see from 2019, the uninsured rate was 4.9. And in 2021, it dropped to 4.4%. So that's really great for Virginia. It still leaves Virginia about middle of the pack nationwide in terms of uninsured rates, but it's definitely moving in the right direction. But we know that a child's immigration status also really impacts access to health coverage. So for undocumented children in particular, there's very limited access to health coverage. These children are barred from accessing Medicaid or CHIP, also known as FAMOUS here in Virginia, as well as ACA coverage. So it doesn't matter how low income their families are, they are not eligible for these programs. And their parents are often working very low wage jobs that either have no offer of health insurance or has a very high, expensive, unaffordable offer for health insurance. So that means that these children often have little to no options, and the families of these children have little to no options. We also know that legally residing children, they may be eligible for these programs for Medicaid and the ACA. However, often there's conflicting, discussions around eligibility depending on what state you're in, and so oftentimes parents are confused as to whether their child is eligible, or they might just not be willing to enroll a child due to fear of their own citizenship status. So all of that kind of combines, and we see that impact in the rate of uninsured here in Virginia. The uninsured rate for citizen children is 3.7%, very low. The uninsured rate for for non-citizen children in Virginia, 29%. This includes legally residing children that are just not citizens yet. And then, as you see, when it comes down to undocumented children, nearly half of undocumented children in Virginia are uninsured. So this is a real equity issue. It's clear by the data, and it's not for lack of wanting. It's very clear that there's a lack of access. So there's the Cover All Kids policy. So what the Cover All Kids policy basically says is that all children from low-income families should have access to affordable and accessible health coverage in Virginia. So the option would be to create a state-funded health coverage program, regardless of immigration status. And this program would look and feel just like Medicaid for people who are trying to enroll, but it would include some enhanced privacy protections, just because we know that our immigrant neighbors often are kind of wary of giving their information to government agencies, right? So you want to make sure that they feel comfortable giving that information over, and that it won't be handed, and that it won't end up in the hands of someone that they didn't want that information going to. So we know that this coverage option would ensure that 13,000 children currently living in Virginia would have new access to health coverage. And that would really make a big dent in terms of our overall uninsured rate. So nearly 1 in 10 children who are currently uninsured would be getting coverage, would be able to get coverage if we pass this policy. And so this was what happened with the Cover All Kids bills in this past year. In the House, we always knew it was going to be a fairly difficult challenge. And that's what happened. And it died in its first hearing. It was a long, long night of waiting for the bill to be heard, and appreciated the folks who were there. But it eventually died on a partisan vote. But in the Senate, that's where we were really excited to see it progress as far as it did. It passed its committee, Senate Education and Health Committee. It passed Senate Finance. Since this has a fiscal impact, it needs to go to Senate Finance, and it passed that. Then it passed the Senate floor. So all senators voted on it. It passed with, I believe, 24 to 16 margin. So there was some bipartisan support, and it was included in the Senate budget. Unfortunately, when the Senate bill went over to the House, it died in the same subcommittee. But we are monitoring the conference budget to see if it is included in the final budget. If the money and the policy is included in the final budget, then there's the opportunity to see this policy actually make a dent and go forward in Virginia. In any case, this is the farthest any Cover All Kids bill has ever gone in Virginia, which is very exciting. And it's really positioned to be a key healthcare policy in the coming year. So again, we got really strong support from individuals. So there's a couple op-eds that we got that we learned about. We have over 60 organizations supporting this, and that's providers, that's clinics, as well as immigrant rights organizations and healthcare advocacy organizations. And so, we are looking forward and hoping that we could continue to build this coalition to continue to tell folks that there's a desperate need for health coverage for this population that really has no options at this point. Folks right now kind of bounce around from free clinics to maybe hospitals, and it's just not a cohesive program. The free clinics are a great option, and they do so much for our communities. However, that's not a healthcare home, and they know that, and they would love to see these folks in a home, healthcare home, in a primary care setting, or if they need some really important treatment, that they aren't worried about going to a hospital and not knowing if they'll get that medical debt forgiven or hospital assistance. And the last thing I just want to share with you, here's our contact information for TCI. So just like Virginia Interfaith Center, you can follow us here on social media if you'd like. But I just want to kind of just share this one story from this child I heard. We had a group visiting from Northern Virginia high school. as part of it was an immigrant justice advocacy day. And she just shared how in 2021, she was diagnosed with COVID, and her family and herself really waited until it got really bad for her to get hospital to go to the hospital due to fear of the cost involved. Now, this was not an easy decision for the parents, but they waited. So it got so bad. She went to a hospital. She stayed in the emergency room for or in that initial hospital for I believe 2 days. She said was transferred over to Children's Hospital in Washington D.C. For a further 3 days because she said she developed blindness due to some complications. So finally, she was fine. She got sent home after 5 days, and then they got the bills, and it was about $200,000 in bills, and she just kind of broke down at that point and was sharing the fact that it was really difficult for her to see her parents kind of crying over the dinner table, praying about what to do here and praying that they would get some help with through the church that they were a part of or through the hospitals. And that lasted for about 2 months. Now, thankfully, the hospital went ahead and gave them assistance, right? But for those 2 months, this family and this child were in limbo. And if they just had health coverage, then they wouldn't have had that pain and suffering from that time. And they probably wouldn't have waited so long to get that assistance in the first place. So I think that's a story that really stuck with me and really just underlined the importance of this policy. And I just, thought at this juncture, it'd be important to share for folks if they were all. But I think it just kind of brings it to the real world rather than showing numbers oftentimes. So that's it in terms of what I have to share. I see there's some questions in the chat, so maybe I can do. So the assumption is that no. So the assumption is that there's 13,000 undocumented children who are under that are at the income level that they would actually qualify for Medicaid or for CHIP if they weren't undocumented. So there's more than that amount in Virginia. There's also more than that amount who are uninsured, but this is the amount of uninsured, undocumented, and low income individuals that we estimate that Migration Policy Institute actually helped us estimate are in Virginia. Now with the US born children and all that, I think it's kind of tough to kind of include them in this estimate. We could say, as part of this policy, let's make sure that every child who's currently eligible but not enrolled is enrolled. I think that would be a larger number, but it would kind of change the framing of the policy. But it is something that New Jersey actually did. New Jersey said, we're going to do a 3-step Cover All Kids program. Our first step is going to be, we're going to make sure that every child who's currently eligible but not insured is going to get coverage by doing a strong outreach program. Then we're going to open this up to make sure that undocumented children are enrolled or eligible, and then move forward from there. So the cost of covering those 13,000 children, the startup cost, which was included in the budget this year, is $7.3 million. And then the next year would be 12 million. And then moving forward, it'd be about 24 million is what they estimate in the third year. Now, it might sound like a lot of money, but when you think about the larger Medicaid and CHIP budget, there's billions of dollars in that involved. And there's also a lot of studies there that show investment in children's health coverage really pays off in the long run by making sure that kids are going to school, they have better educational outcomes, and they have better workforce outcomes, which means that maybe in the future they won't necessarily be in need of governmental assistance, that they'd be able to kind of pay their own way, and also just spend their money instead of paying money for medical debt, their families would be able to pay for those essentials, and which also kind of boosts the local economy. So yeah. So Senator McClellan was the patron in the Senate. Now she's moved on to better things. So we'll be looking for a new Senate patron, but Delegate Tran looks like might be our patron in the House again, and she's already committed to carrying this bill once again for next year if she is able to. So we're really excited to continue this fight moving forward. So. And feel free to contact me after this, or just continue to put those questions in there. I'm happy to kind of share. So, thanks.
Thank you so much, Freddie, and thank you, everybody. So yeah, and you know, spoiler alert, Virginia Interfaith, as you may have guessed, is going to keep pushing on the implicit bias training with the PUSH Coalition, and we're going to keep pushing pending board approval, but we're hoping to prioritize Cover All Kids in our legislative packet next year, because it's such an important thing that affects so many people around Virginia. And we want to make sure that health equity remains a priority for Virginia Interfaith. So we are looking forward to that. I now sort of want to open the floor and talk a little bit about what you can do within your own congregation and your community. And yeah, I just wanted to throw out there a few ideas. We have a widely diverse group in terms of geography and in terms of faith tradition, and I am grateful for that, because we are interfaith, and it's important to recognize that it's not just, you know, one of the slogans that we've always got on the wall at the VICPP office is that all faiths believe in justice. We are all called to do this work together. And so I'm glad we've got a good group on tonight. So couple of ideas and options and ways to get involved. One, and the easiest one, is to make sure you're on our list, the Virginia Interfaith list, to get action alerts and to get our announcements and our invitations to these kinds of events. I'm throwing the link in the chat, but all of you found your way here tonight, so you may already be on the list. Well done, you. Another way is to partner with us or with your local health department for things like getting resources out to your faith community or inviting a speaker. You know, Kristin mentioned Dora Muhammad, who was on staff with VICPP for over 4 years and was just phenomenally involved with the health equity work. Now that she's transitioned, we are in the process of hiring a new health equity program manager, but I am happy to come and talk about health equity, as are other staff members. And your local health department, of course, knows a lot more about what's happening at the individual level. We can talk about the policy stuff. People like Freddy and Kristin and Sarah, who Kristin is standing in for, can talk about the laws that are possibilities. You know, there's a lot going on, and there's a lot of ways to plug in. You could also use the information from either us or Virginia Department of Health or CDC to pass out flyers or pamphlets in your vestibule, or put announcements in your bulletin. I was looking up the statistics earlier, and in Virginia, 88.9, almost 90% of people have at least one dose of the COVID vaccine, which is actually fabulous. Nice job, Virginia. However, less than 40% of people have the updated booster, which is lower than we'd like it to be. There was just a lot less motivation. And so you can partner with your local health department. You can partner with a lot of people to increase awareness and increase folks reaching out and getting those resources. You can also share the PSAs that I talked about and do other things there. Another thing that you can do, and I mentioned before, I'm the faith organizer, so I get to interface with congregations a lot. You can sign up to be a congregational liaison, and Steve mentioned he is self-appointed liaison. Our dream is to have every single congregation in Virginia have some kind of connection with the Virginia Interfaith Center for Public Policy. For some folks, this is a full-scale partnership where they sign off on all of our legislative priorities and donate to us and all of that. And for some congregations, it's having a person say, hey, I'm going to pay attention to the newsletter. I'm going to add stuff to my congregation's weekly newsletter when it gets emailed out. And I'm going to make sure that my friends and the people I know who care about justice are aware of what's happening at the state level. And this involves both health equity as well as all the other areas VICPP focuses on. Economic justice, affordable housing, criminal justice reform, paid sick days, which is health equity adjacent. All of these are ways to be involved. And finally, you can connect locally. There are other congregations in your area, and I love that Marilyn talked about the risk action. I will be there. But like, there are groups. VICPP has chapters in a lot of these localities. We've got a Northern Virginia chapter. We've got a James River chapter. We don't yet have one in Stanton and Waynesboro, but we're working on it, mentally preparing. Connect with other faith communities in your area, and together you can work on throwing a health fair or canvassing for voters, making sure people are registered to vote. There are all sorts of things that you can be doing on the local level to raise these issues up to the state level. Because at the end of the day, that's what it's about. We live, our government might dig their heels in now and again, but they are there to represent us. And so we need to speak out about what's important to us. And we have the joy and the privilege of taking care of ourselves and each other, both in terms of health and in terms of policy. And so again, I am so grateful to have all of you on this call this evening. Happy to hang around if you have any questions. I'll throw my email in the chat as well. And yeah, just delighted to continue the conversation. Any other questions, comments, suggestions of things people can do locally?
I just want to say, Sheila, the James River chapter will be given a program relative to gun violence. Julian, you have the information on that with you?
Yes, sir. The date is April the 22nd from 2 to 3:30. It'll be held at the St. John's Church of God in Christ. It's called the Raw Tools event. Trying to figure out a way I can share it on you.
I can share a very short version of it, but it doesn't have all the information.
Okay.
Basically, there is an anti-gun violence movement happening nationwide, and the James River chapter, as well as the Hampton Roads chapter of Virginia Interfaith, are hosting Shane Claiborne, who's from an intentional community in Philadelphia, to do an interfaith prayer and community event around anti-gun violence. And the point of Raw Tools is they take guns and turn them into gardening implements using a forge fire. So very biblical roots. I've not been, but it seems like a really cool organization, and I'm looking forward to it. And I didn't mean to cut you off, Julian. You can share more as well, or
No, you did amazing. You did amazing. You took the words right out of my mouth. You did good.
Sheila, I'm a retired ESL teacher here in the Richmond district.
Mm-hmm.
And I finished my schooling at Broad Rock and Oak Grove, which is on the south side of Richmond. And I think that the biggest impact that anybody could give is to go into a school, especially a lower socio school, and tutor English.
Mm-hmm.
The kids really crave it.
Yeah, that makes sense. Absolutely. That is a huge gift. And again, I'm just so grateful for all of you for being on this evening. Thank you for being a part of the conversation and a part of the ministry. don't hesitate to reach out if you've got any questions. And yeah, happy to continue working on this as we move forward.